Hi, hello, namaskaram. Good evening, all. My name is Jessie George. I am the president of Kerala Association of Connecticut 2022. On behalf of KACT, I welcome you all to this exciting event tonight. കഴിഞ്ഞ മാസം വാലന്റൈൻസ് ഡേയോടനുബന്ധിച്ച് നമ്മളൊരു ലവ് ലെറ്റർ റൈറ്റിംഗ് കോണ്ടസ്റ്റ് കണ്ടക്ട് ചെയ്തിരുന്നു. First of all, I want to thank everyone who participated in the KACT Arts Literacy Club Premalekhanam contest in making it a big success. പ്രണയം ഇപ്പോഴും മനസ്സിൽ നന്നായി പൂത്തുലഞ്ഞു നിൽക്കുന്ന കുറേ റൈറ്റേഴ്സ്, ടാലൻറ്റഡ് റൈറ്റേഴ്സ് അതിൽ പാർട്ടിസിപ്പേറ്റ് ചെയ്തു. എല്ലാവർക്കും താങ്ക്സ് ആൻഡ് കൺഗ്രാജുലേറ്റ് ഓൾ ഓഫ് ദം. The letters were numbered before we sent them to the judges, so they didn't know who wrote what, and they just evaluated. And it was really a tough decision, as everyone's scores were really high, really close, I should say. So it was such a tough decision for the judging panel to find a winner. We would like to thank all the judging panel. They were PM Jacob Sanyango, Suresh Jayaprasad, Achi Jacob, and Rini Mambalam. So now you all want to know who won the contest, right? The first place winner of the contest is Shrija Anu. Congratulations, Shrija. She's a very new member of our KACT family. Thank you, Shrija, for participating. And her trophy is ready, and KACT Arts Literacy Club will deliver it to you personally. And participate ചെയ്ത എല്ലാവർക്കും certificates ഉണ്ട്, അതും എല്ലാവർക്കും mail ചെയ്യുന്നതായിരിക്കും. So now we can see the trophy and the certificates. We would like to thank Abdul Harris, Budget Tours and Travels, for sponsoring the prize. ഇന്ന് നമ്മൾ KACTയുടെ മറ്റൊരു സബ് ക്ലബ്ബ് ഇൻട്രൊഡ്യൂസ് ചെയ്യുകയാണ്, KACT Arts Health Club. It'll be a great opportunity for our members to get together to discuss health-related topics with our own KACT doctors and speakers. We can also have yoga, Zumba, diet discussion, and group exercises in this club. Together, we can experience a healthy lifestyle by joining this group. If you are interested, please inbox your phone number on the KACT Facebook official page to be added to KACT Arts Health Club WhatsApp group. And you can also send your WhatsApp number to mykact@gmail.com, mykact@gmail.com. Okay. An apple a day keeps a doctor away, but we don't want to keep our doctors away. We need them, right? But you still should eat an apple a day. In the KACT Arts Health Club in the kick-off event ആയിട്ട് നമ്മൾ ഒരു ഓൺലൈൻ ടോക്ക് ഷോ പ്രസന്റ് ചെയ്യുകയാണ്, Doctorodu Chodikkam to you. A very informative and valuable session by our very own KACT doctors. Any questions and concerns you have can be addressed, which will be answered by our own doctors during the program. But please type your questions in the chat box, in the chat window, or Google Doc link given in the chat box. So don't forget to eat your apple. Our event sponsor for today is Mrs. Kala Prasad, the author of the book Ancient Wisdom for Modern Times, which is available on Amazon. The host for today's program is one of the KACT 2022 Board of Directors, Mrs. Indra Pulliyadath. Indra is a nutritional therapy practitioner with a focus in autoimmune conditions. She's also a pharmacist and has worked as a researcher in the healthcare industry for 15 plus years. She has a severe form of rheumatoid arthritis, which she is now managing successfully with the combination of medications, diet, and lifestyle changes. She's also the author of the book AIP Indian Fusion, a healing cookbook for autoimmune patients. Indira did her MS in pharmacy from University of Florida and MBA from UConn. She's also a nutritional cooking instructor, and she blogs her healthy recipes on cooktonourish.com and on her YouTube channel. So enjoy. Over to you, Indira. Thank you.
Thank you so much for that lovely and kind words, Jessie. I'm actually so honored and so grateful to be here today with this amazing team of doctors that you have. I think KACT is doing such a wonderful job of trying to focus on this topic of health and wellness. And this is something that, sometimes in our busy lives, we forget to give health the due importance that we should be giving. Health is wealth in നമ്മളെ എല്ലാവരും elementary സ്കൂളിലൊക്കെ പഠിച്ചതാണ് saying, but what it actually means, for me at least, that realization came many years later when I was much older. And the first time when my mom was diagnosed with a critical illness, that was when it really struck me how important health is. And a few years down the road, even I was diagnosed with a chronic illness that made life very challenging for me. So that's when I really got the perspective of how you can have all the luxuries and all the modern material goods, but if you don't have your health in order, nothing matters, nothing else matters truly. So that's why, again, I really commend KACT for putting this show together and bringing these amazing, incredible team of doctors to us today, where we will be discussing on some important topics, getting their advice, and most of which I'm sure you guys will be able to directly take and implement in your daily life, and so that you can improve your own health as well as the health of your family. So I will start by going around the panelists and doing a quick introduction. But before that, I also wanted to just give a quick rundown of the agenda for today. So what the agenda looks like is, we have prepared some questions for on different health topics, because as you can understand, health is a very vast topic. So we have tried to create 4 important segments, and we have some prepared questions in the area of, first is Corona or COVID. I know a lot of people have a lot of questions on that, although we are also very bored with that topic. But nevertheless, we do have to address that elephant, right? So we will touch upon that. The next one is about general health, and included within the general health category is also dental health. And then we will also focus specifically on mental health, which also is another very critical, important aspect of overall health and wellness. So those are the 3 main segments. And after that, we have a 4th segment where we will be addressing or taking in questions directly coming from all of you members. So for that, I believe a link has been shared, which is a Google Drive link. So Google document link, so people can actually go in and submit your questions in that form. And in the last section, we will take those questions, and the doctors will be happy to answer those questions for you, depending upon time constraints, of course, but we have dedicated about 15 minutes for that Q&A session. Make sure when you are asking the question in that form, make sure that it is, keep it a little bit general. You don't want to ask very specific medical related questions or individual medical questions, because unfortunately, our doctors will not be able to answer that in this kind of a forum. So keep it general, but definitely, get your question in. All right, so that is kind of the agenda. And then to keep things interesting, we are also going to be sharing some important and fun health trivia in the chat. So you can participate and see if you can answer those questions. So that's what the day looks like. And now I will go around the panelists and give a brief introduction of each of them. But yeah, one more thing before I actually get started, I wanted to just take an opportunity to say thank you to all the doctors here, not just the panelists, but also all the other doctors that we may have in our community, in our membership, of all the amazing hard work that you guys have been doing in these past 2 years in the COVID world, right? You have been out there in the front lines working hard so that we all can be safe and healthy. So we really, really appreciate that. And thank you from the bottom of our hearts. All right, so let's now go around and take a look at our amazing panelists. So first, I would like to introduce to you Dr. Suchitra Verma. She is MD Internal Medicine. And Dr. Suchitra Verma is an internist in West Hartford, Connecticut, and is affiliated with UConn John Dempsey Hospital. She received her medical degree from Government Medical College, Thrissur, and has been in practice for nearly 20 years. She lives in Avon, Connecticut, with her husband and 2 kids, Raghav and Janvi. In her spare time, she likes to read and listen to music. Pre-pandemic, she loved to travel. Didn't we all? We have to look for new hobbies now, unfortunately. But hopefully you can get back to your passion, Dr. Verma. Our next panelist is Dr. Surendran Verma. He is MD Geriatrician. Dr. Surendra Verma is geriatric medicine specialist, also practicing in Bristol, Connecticut, and has over 25 years of experience in the medical field. He received his medical degree from Calicut Medical College and did his post-graduation from Trivandrum University and also from Kerala Medical School. He is affiliated with Bristol Hospital. His interests outside of work mainly are music and sports, especially cricket, tennis, and badminton. Thank you, Dr. Suchitra Verma and Dr. Surendran Verma for being here today. Our next panelist is Dr. Remy Matthews. She is MD Family Medicine, and she has been primary care physician for the last 15 years in Manchester, Connecticut. Remy did her family medicine residency from University of Connecticut and medical school from PSG IMSNR, Coimbatore. She is the Associate Program Director and Faculty at Eastern Connecticut Family Medicine Residency Program. She is also Associate Professor, University of New England, Osteopathic Medical School. She lives in Glastonbury with her husband, Dr. Shari Matthew, and 2 kids, Abigail and Andrew. She enjoys working with underserved populations, teaching medical students, traveling, and cooking. Wow, that's quite a bit of different hats that you are wearing there, Dr. Remy. We are so fortunate to have you here. Welcome. Next, I want to introduce to you Dr. Shari Matthew. He is DDS family dentist. Dr. Matthew has been practicing all aspects of dentistry in his highly successful Manchester practice since 2006. He subsequently has also opened Bloomfield Family Dental Center in 2012. His pursuit of constant and never-ending improvement has led him to continuing education classes all over the world, where he spends much of the time studying aesthetics, implant surgery, and bone regeneration. Dr. Matthews' #1 goal is to provide quality personalized care, as he understands that each patient is an individual with their own unique needs. While he enjoys performing cosmetic and reconstructive dentistry, he strongly feels that preventative dentistry is the foundation of all dental care. He and his wife, Dr. Remy, whom we just saw, they have 2 children and they live in Glastonbury. Dr. Shari Matthew also has his qualifications from University of the Pacific, Arthur A. Dugani School of Dentistry, as well as Wheaton College and Staten Island University Hospital. Welcome, Dr. Shari. We are so excited to have you here. And finally, we also have Dr. Saira Matthews, who is also MD Internal Medicine, and she's also a diplomate in American Board of Obesity Medicine. So she's internal medicine specializing in obesity medicine. She did her internal medicine residency from SUNY and medical school MBBS from Government Medical College, Trivandrum. She is board certified in internal medicine and obesity medicine. She's a hospitalist, primary care physician for the last 16 years in Connecticut, and currently primary care physician and obesity medicine specialist at VA Connecticut. She resides in Glastonbury with her husband Biju Matthew and 3 daughters, Miriam, Manna, and Naomi. Dr. Saira enjoys offering assistance, advocating, and taking care of the healthcare needs of our veterans and the underserved. Her special interest in obesity medicine and lifestyle medicine and whole health, as well as integrative medicine, these are our special interests. And outside of medicine, Dr. Saira enjoys public speaking, crafts, embroidery, traveling, gardening, and counseling. Wow, is there anything that you do not like, Dr. Saira? It's very, very impressive. All the credentials, all our doctors, it's such an amazing team. Thank you everybody for being here today. And I think we can get started. Ille, appa namukku thodangam. Doctorodu Chodikkam. So as I said before, we have prepared a few questions. So we'll just get started with that. So the first segment that we are going to talk about today is the much, famous or infamous coronavirus or COVID. We honestly have had enough of this, right? Word itself. It just feels like the 4-letter word right now. But we have to address it. We have to know, what we need to do to keep ourselves safe. So to begin with, I would like to ask Dr. Remy, what do you have to say, Dr. Remy, about the situation right now? Is it safe to say that the worst is over with respect to the coronavirus, or is it too early still to make that conclusion? And along with that, I know I'm going to be adding a couple more questions, but one other thing that really everybody's, wanting to know is, are there new variants that are still likely to appear in the months ahead?
Good evening, all. Thank you for the question, Indra. As we all know, we've been stressed and our lives have changed over the past 2 years with this COVID-19. The last year, and it's still continuing. But, there is hope that things have become a little bit better. What you need to know is you should know your COVID-19 community level. How you know about the COVID-19 community level, it's a tool that CDC has done to see how the level in your community is. So the levels can be low, medium, or high. And that's determined by the hospital beds being used, hospital admissions, and the total number of COVID-19 cases in our area. And obviously, you have to take precautions to protect yourself and others from COVID-19 based on the community level in your area. And this is by the CDC. So right now in our area, the community level is low, which is great. That's why they probably lifted the mask mandates within Connecticut. And in regards to whether it's over, is a $1 million question, because it's still not over, it's still existing. Eventually, by the time in probably a year or two, maybe this will eventually become an endemic. The pandemic will eventually become endemic, which means that we'll have to live with this virus probably for the rest of our lives. And in regards to masking, obviously you may choose to mask at any time. If you have symptoms, you mask. If you have a positive test, you mask. Exposure to someone with COVID-19, obviously you should be masked, and if you're immunocompromised. And in regards to the question about new variants that is arising around us, there can be, being a virus, there can be so many new variants that is expected to occur. The latest one is the Omicron and a subvariant called the BA2 Omicron subvariant, which has been around for the last few weeks. as we know, there was like 5 variants of concern that the CDC and WHO have told us, which is the Alpha, the Beta, Gamma, Delta, and the current Omicron. Viruses are known to constantly change through mutations, causing new variants. So the variants are expected to come across, and some of them will disappear and some will persist. And the CDC is working with state, local, and public officials to monitor the spread of the variants. And slowing the spread of the virus by protecting ourselves is what we should do, which will help prevent the emergence of new variants. Like the Omicron, we knew it was spreading fast and, causing issues, but less deaths. So again, masking was the way that we protected ourselves, and by getting vaccinations, which is very important. Getting the vaccine will reduce hospitalizations, severe illness, and death.
Great. Thank you so much, Remy. Oh, that was very, very useful. You mentioned about, keeping track of the levels. Is there a particular website that you would recommend to do that?
We can go into like the CDC website. There is like a tool that you can put in Connecticut, and it'll show us if it's a low level, medium, or high. Or you can go into like the ct.gov has a website where you can go in and see the number of cases and the number of deaths within the community. It even shows us each county, like it'll even show Glastonbury, South Windsor, different areas as well. So that would be a good tool to know the spread of the virus, or how many positive cases, how many deaths within our area.
Okay, great. Yeah, I think that's going to be very useful. I think those websites that you mentioned are very useful. So thank you. Thank you once again. And we'll come back to you with other questions, okay? But thank you for now. And again, with respect to COVID, and Dr. Remy kind of touched upon the mask, but I also wanted to ask Dr. Saira her opinion in terms of what she feels or how she feels about the fact that the mask mandate has been lifted in many places right now. And since Dr. Remy also mentioned that it is very important that you mask, so how do you feel about the mask mandate being lifted off? Is that a cause for concern, or what do you think?
Good evening, everybody. Thanks for having me. It's a privilege being here today in your midst. Appam ee mask aanu something which had a very important role to play in this pandemic. So face mask became a very crucial public health tool during the COVID-19 pandemic, but the rules and recommendations around the mask continue to change constantly, even during the peak. So whether you need to wear a mask and the type of mask you should wear depends on the impact COVID-19 has in your community, just like Dr. Remy just mentioned, at that particular time. So according to the new guidelines from the CDC, how now as the cases are coming down, and especially after the massive Omicron surge, people in many areas of the country were told that they could stop wearing the mask. And many a time, we as human beings, we enjoy and we do the things we like to hear. Appam ingane mask vendam ornappo pettanna mask eduthe valicheriya. Appam most of especially kids, okay, children and everybody, they had the feeling graduation mask eduthe theriyilla. Adupole they had that feeling, oh, we can fling it, we don't need a mask anywhere. Adangante feeling. Pakshe, wait, it's too early to do that.
Can't blame them though, right?
Absolutely not. Pakshe, we have to, those are apparana, certain things become important. You should always keep in mind that in future, the mask recommendations in an area may change. It depends on certain criteria. Excuse me. And depending on the strain on the healthcare and the number of cases, the vaccinations, they were able to say that we can for now remove the mask because especially in the US, 66% people are vaccinated. In Connecticut, almost 78%. The strain on the healthcare workers, the number of deaths, hospitalizations have come down. So that was the reason which prompted them to lax the criteria. And we see that COVID-19 did not follow any predictions. Nobody could say, Angana, ingana change, but it kept changing, so nobody didn't follow any pattern. So, and we all know that it is probably not going to end, because one after the other, newer strains kept coming, and pretty much you're sure it's not going to end, and very soon it's going to be like flu, every season. Pakshe, we take the precautions. And so in short, factors which influence the need to wear the mask are as follows. One, the prevalence of COVID-19 cases in the community. Remy Barne bola, you can find out in your community, even at a county level, it's available. Next, vaccination status of the people in your community. Third, your personal health and that of the people you interact with. So if you interact with immunocompromised people or high-risk people with severe illness, then you are at high risk to get. For example, in an area, the vaccination status is high, less of, and the number of hospitalization is less, people are more healthy. You can go in public places and areas without the mask. But if you were to come in a high-risk community where there are immunocompromised people, vaccination is less, the number of cases go up, then you have to use the mask. So I would say it should be like, it's not like something which you can throw away. It's like when it gets cold, we take the muffler out, we take the blouse out, coat out, don't throw it away, keep it. According to things change, as it changes, you would need it again. And then regarding children also, they said you can take away the mask off for the children. Schools has been decreased. That again, the criteria could be because the people are more vaccinated and then the number of cases are less. But again, you should keep in mind, children under 5 are unable to get vaccinated, and the rates of vaccination among kids who are eligible also are much less. And there's some research suggesting that the vaccines are less effective among 5 to 11-year-olds. So again, and children are less protected than adults. So that is also another reason for being careful, and also the kind of people the children interact with. Immunocompromised parents or grandparents, then they have to be more cautious. The other thing is, what kind of mask should you wear? Say, for example, we have the cloth mask, we have the N95, we have this.
Did she freeze?
Much better than the other ones. Pakshe, I would say that the best mask is the one which you will wear it and which has a snug fit and you will wear it. You wear the best mask but keep on touching it and not wear it, pull it down, it beats the purpose. So the one which you will wear and which fits well is the one you should use. Then last but not the least, the hand hygiene we learned, and all we have to keep it, because we have seen a significant decrease in the number of flu virus cases this year, and also allergy related and other viral illnesses. Why is it so? I have to say that the mask did play a role in it. So this is something, maybe the mask will, for at least for some people, it is to stay, especially in the annual, in the season, it might be needed. And in the future, it is possible that depending on the case and everything, you might end up getting more booster shots. Plus, it might be an annual vaccine along with the flu shot.
So you actually went to my next question about the vaccine. So that's perfect. So what I was going to ask was about that. Will we need to get booster vaccines now again in the near future? And how long do you anticipate? You mentioned kind of like an annual thing. Is that what
looking at the trend, I don't think coronavirus is going anywhere. It is going to get mutated. More and more newer strains are coming. And for that, we need the protection. And it is going to be a co-mate, twin sister, twin brother of the flu. So very soon it's possible that they might combine it with the flu vaccine. So
Okay, so the vaccines are here to stay, the masks are here to stay. We need to have designer masks that we can have in our wardrobe, in our collection, right? So, yeah, thank you so much. I'm sorry, did I interrupt? Were you saying something else?
No, you didn't. Absolutely not.
Okay.
Thank you.
Well, thank you so much. That's a lot of information and very, very useful. Thank you, Dr. Saira. So we are going to go into the next segment, general health. But before that, I wanted to remind everybody again to, that there is a Google link there in the chat box where you can go and submit your question for the live Q&A segment, or you can also directly type it in the chat box. Did we share the trivia yet or not? Okay, we'll be starting that too, I guess. So keep an eye in the chat box for the trivia questions coming in. And now we will move on to some general health questions. So we will go to Dr. Suchitra Verma next. Dr. Suchitra, hi, how are you?
Hello.
Okay, so can you tell us something about the top screening and preventative tests that you in general recommend for both men and women above the age of 40?
Namaskaram. So when we start talking about screening, there's actually like screening for various cancers and also for certain like chronic diseases. So first about the screening, so we start with like mammograms. It's basically for the screening for breast cancer. Like we recommend annual screening for the women between the ages of 50 to 75, according to like most of the guidelines. Between the ages of 40 to 50, we start having a conversation. It actually like depends on the family history, the personal history, and of course the patient's preference as well. The other screening is the pap smear. It's the screening for cancer of the cervix. Other number recommend to start at the age of 21 to 65 years. If they are also screened for the high risk HPV virus, another it only needs to be done every 5 years. For both men and women, we also recommend like getting a colonoscopy. നമ്മൾ 50 വയസ്സിലാണ് സ്റ്റാർട്ട് ചെയ്യണമെന്നാണ് പറഞ്ഞിരുന്നത്. ഇപ്പോൾ അത് നമ്മൾ 45 ഇയേഴ്സിൽ സ്റ്റാർട്ട് ചെയ്യണമെന്നാണ് ഇപ്പോഴത്തെ ലേറ്റസ്റ്റ് റെക്കമെൻഡേഷൻ. പിന്നെ ഉള്ളത് ഇറ്റ്സ് സ്ക്രീനിങ് ഫോർ ദ ലങ് ക്യാൻസർ. It's done by a low dose CAT scan, and that's for like people between the ages of 50 to 80 who have smoked, like who have a smoking history of like a 20 pack year smoking history. Appo idana nammal main aayittu ulla cancer screening. Pinne chronic disease inde karyathil we screen for hypertension, for diabetes by doing a fasting glucose or something called a hemoglobin A1C. They're both in the blood. The others are like screening for the lipids or the cholesterol. We also screen for depression and anxiety, and also for the AAA or the abdominal aortic aneurysm. And that's usually for men over the age of 65, ഒരിക്കലെങ്കിലും സ്മോക്ക് ചെയ്തിട്ടുണ്ടെങ്കിൽ. പിന്നെ ഉള്ളത് screening for osteoporosis. It's done by DEXA scan. Basically, it's X-rays ഓഫ് ദ ബാക്ക്, പിന്നെ ഹിപ്പിൻ്റെയും. അത് നമ്മൾ 65 വയസ്സിന് മീതുള്ളവർക്കാണ് ചെയ്യാൻ പറയുക. അല്ലെങ്കിൽ നേരത്തെ എന്തെങ്കിലും വേറെ വല്ല റിസ്ക് ഫാക്ടർ ഉണ്ടെങ്കിൽ കുറച്ചുകൂടി നേരത്തെ ചെയ്യാൻ പറയും. ഇതാണ് മെയിൻ ആയിട്ടുള്ള സ്ക്രീനിങ്സ്.
Okay. Appa either doctor in the അടുത്താണ് you have to go to do all this? Is it like general practitioner?
ജനറൽ പ്രാക്ടീഷണർ അടുത്താണ്.
internal medicine?
പിന്നെ നമ്മളിപ്പോ മറ്റേ ഈ പാപ്സ്മിയർ ഇപ്പൊ എല്ലാ ജനറൽ ഫിസിഷ്യൻസും ചെയ്യണമെന്നില്ല. അങ്ങനെയാണെങ്കിൽ നമ്മൾ വേറെ ഈ OBGYN അടുത്ത് പോകണം.
OBGYN. And
പിന്നെ മാമോഗ്രാം ഒക്കെ ചെയ്യണത് മറ്റേ ഈ റേഡിയോളജി ഇതായിട്ടാണ് പോവുക. മറ്റേ കോളനോസ്കോപ്പി ആണെങ്കിൽ GI-യിൽ. അപ്പൊ നമ്മള് അത് നമ്മുടെ ഇൻഷുറൻസ് അനുസരിച്ച് ഒന്നല്ലെങ്കിൽ PCP റെഫർ ചെയ്യണം, അല്ലെങ്കിൽ അവര് തന്നെ ഇഷ്ടമുള്ള GI കണ്ട് ചെയ്യേണ്ടി വരും.
Okay. You talked about hypertension and cholesterol alarm. So that alarm your internal medicine itself, right?
Internal
and that's
medicine.
like once a year you recommend?
Once a year, depends on the age. അപ്പൊ നമ്മളിപ്പോ above 50 we recommend doing it yearly. But between the ages of 40 to 50 it depends on your personal history. If you're otherwise healthy, you can go every 2 or 3 years. But if you do have hypertension, it becomes more frequent. The follow-up should be more frequent.
Okay. Okay, thank you so much. Yeah, that makes a lot of sense. And you covered a lot of different tests, for both men and women. And so I was curious, actually, you talked about colonoscopy, the age limit, it was like 50 and above, and now it's 45. Is that because there is high incidence of colon
higher
cancer?
incidence of people, മറ്റേ പ്രത്യേകിച്ച് ഇപ്പം ഈ ന്യൂസിൽ തന്നെ കേൾക്കാം, കുറെ ഫേമസ് ആയിട്ടുള്ള ആൾക്കാർക്കും ഉണ്ട്. പക്ഷെ ഇൻ ജനറൽ പോപ്പുലേഷൻ, അപ്പൊ അതുപോലെ ഈ ജനറൽ പോപ്പുലേഷൻ ഇപ്പൊ നമ്മൾ കൂടുതൽ like people in their 40s നമ്മൾ കണ്ടു തുടങ്ങി ക്യാൻസർ. അപ്പൊ അതുകൊണ്ട് അവര് ഏജ് കുറച്ചുകൂടി കുറച്ചു.
Okay, that makes sense. Yeah, thank you. Then adutha question, actually I'm going to go to Dr. Remy again. So this is again related to women, and specifically wanted to talk about women undergoing perimenopause or menopause. And what are some tips, Dr. Remy, you can provide for these women who are undergoing these, and what can they do to make this phase of life easier for them?
And there's perimenopause and menopause, and most women, they go through, giving birth to children, taking care of their families, and then by the time they reach about 45 to 55 years, mean age of 51, they end up having menopausal symptoms, which is a lot on their body, and they have to deal with this while they're working, taking care of their family and kids. And I encourage all women to bring this topic up to their primary care physicians. It's not of shame or anything like that, because this will help us lead a better life to take care of our family and our health and work. So menopause, what does menopause mean? Menopause, all it means is this decreased ovarian estrogen production. So the low estrogen can cause all these vasomotor symptoms, which means hot flashes. So what is hot flashes? What are the symptoms of hot flashes? So hot flashes in the nacha, you feel like your skin is suddenly getting warm. Some people experience redness on their face, blushing in their neck, ears, or chest. And some people can just have sweating in the upper part of the body or tingling in their fingers. And some people also can have a faster heartbeat than usual. So there is different treatments and different avenues for hot flashes. You must have heard about hormone therapy. What the hormone therapy does is it's giving you extra hormone to help alleviate these symptoms. But hormone therapy il kore risk factors under breast cancer varam. So you have to be very careful when you're on hormone therapy, and your gynecologist or your family practice doctor or internal medicine doctor, whoever is treating you for the menopause, should not be giving you hormone therapy for more than 3 to 5 years, because that will increase the risk of other things that can be detrimental to your health.
And certain regulatory agencies like the ACOG, which is the main regulatory agency for the OBGYNs, they suggest that it should be given with the smallest effective dose and for the shortest duration possible. And estrogen does help with hot flashes. There are other alternative therapies like venlafaxine, gabapentin. All these medications can also help. In Allada, herbal formulations also, you must have heard of black cohosh, dong quai, ginseng, kava, and certain dietary soy are among all the others that can give women some benefit. Pinna topical estrogen therapy monda, which is a topical, it's a cream that's applied topically, can help with the vulvovaginal atrophy, which can help with these symptoms. And what they say is, despite the effectiveness of estrogens, you can try other things as well. Ippam pudhidayittokka vanna bioidentical hormone therapy or certain compounded hormone formulations are also given by some physicians. That can also be effective.
So are these biological formulations a little bit more closer to the natural hormones, right? So by that token, are they do they have less potential to cause side effects?
Yes, they probably have less potential to cause certain things like breast cancer and heart diseases in women who are at high risk.
Mm-hmm.
People with a family history of heart attacks, hypertension, diabetes, which will put us at higher risk for heart disease. Those women, you should be very careful with taking oral estrogen. That's why you have to avoid it and try the lowest possible dose. You want to use alternative therapy to give them some relief from these postmenopausal symptoms.
Right. Great. That's a lot of information you talked about, Doctor. I wanted to also ask you, because I have a lot of interest in this topic, having undergone some of these symptoms myself, experiencing and trying a lot of different diet strategies. I've definitely, experienced that changing up diet as well as some lifestyle factors are, very important too, like stress. Have you seen or have had any experience with that yourself?
I agree. Lifestyle changes can relieve hot flashes. Exercising, doing yoga, relaxation techniques such as meditation, slow breathing, all that definitely can alleviate, all these symptoms and kind of give you a little bit boost in energy and your overall health. Pinna wearing loose clothing, using a fan, trying not to drink too many hot drinks during that time can, alleviate some symptoms as well.
Yeah.
My advice is, a lot of medications can have side effects. You should decide what is good for you along with lifestyle changes and talk to your PCP about these issues that you have, and they can give you a better idea of what's good for your health and what would be an ideal treatment for you.
I think that's an excellent point you make, Dr. Remy, about, and I think that's very important to some women might think that, who experience like really severe symptoms, but they might think that I don't want to take any medication because medication is bad, right? Mm-hmm. But if it's really affecting their quality of life, it's important that they consider the value of, consider that, especially the naturally available kind of identical hormones therapy. It's so important that they understand. And you made that great point of, talking to their provider or practitioner and making that decision. Thank you for sharing all that valuable information. Really appreciate it. Now, let's see, we can move on to, again, within the topic of general health, we'll now move to Dr. Surendran Verma, who is specialized in, treating the senior population or the geriatric population. So, Dr. Surendran, can you tell us, for the seniors specifically, age 65 and above, are there special screening preventative tests that you recommend? And, what are the frequency of those kind of tests?
Thank you. Thank you for this excellent opportunity. Generally speaking, as the person gets older, നമ്മൾ സ്ക്രീനിങ് ടെസ്റ്റ് frequency generally കുറച്ചുകൊണ്ടിരിക്കുക. അതാണ് generally that's what we do. As Sujitra earlier told, most of these screening tests are we usually do more during the earlier stages of their life. And for example, if we are taking a colon cancer screening, what we do is like, up to 75, we usually screen them, but after 75, we really need to have a discussion between the patient and the doctor. We have to see, whether they really require all those things, because most of the time, by that time, the patient will have a lot of other, comorbid conditions, and they may not benefit from many of those screening tests. So that is the usual, things. But taking into the older population, there are certain conditions or certain things that we screen regularly, and most of the things which I'm going to tell right now is actually a part of the comprehensive geriatric assessment. And one of the things that we specifically look for in such elderly population is their functional status. They have to screen for how they they live in their living environment, like functional status. That it can be, there are several things that we look for. That's called activities of that, what we usually call it as activities of daily living or instrumental activities of daily living. Usually ADLs, it means, we usually, look for, how they can function in the, like, whether they can do the routine things like bathing, dressing, toileting, transferring. These are the activities of daily living. And there are instrumental activities of daily living, which is like, shopping and preparing food, taking care of the financial matters. ഇതെല്ലാം instrumental activities of daily living ആണ്. അപ്പോൾ ഇതെല്ലാം നോക്കിയിട്ട് we can determine how much actually they require, how much help they require, to live independently in the community. So depending upon that, we can actually refer them, to proper places, like, whether they need extra help or not. And the other condition, which is very important for screening, especially in the elderly population, is the cognitive function. Cognitive function, it's actually a part of, medical annual wellness visit, this screening for cognitive function. And we usually look for certain domains of cognitive functions, like memory, attention, language, and executive function. These are the things we actually look for. And there are certain screening tools are also available. Like, there are, very, very concise screening tools are also, is the one that we usually initially use, like Mini-Cog, which is like 3 questionnaire, and we can screen them whether there is any problem or not. If we find something like there is some problem, we can resort to other, comprehensive screening tools are also available, like mini mental state, MMSE, MOCA scale. There are several screening tools are available. അപ്പോൾ ഇതെല്ലാം നോക്കിയിട്ട് we can determine whether, which is actually very important. And actually age itself is a very strong risk factor for cognitive dysfunction. As you get older, the people, they get more cognitive impairment. And it's also a risk factor for a lot of other things like loss of independence and loss of, it makes you prone for falls, and it makes you having poor control of many diseases they may have. And that is one of them. And then the next thing that we need to screen for elderly population is, it's very important, it's a very important condition which very often we miss, is depression. It's like about 15%. The prevalence of depression is it's like around 15% in the people aged 60 or above. And very often depressed patients we mistakenly attribute to other conditions, like maybe അവർക്ക് ഏജ് കൊണ്ടുണ്ടാവുന്നതാണ്, അല്ലെങ്കിൽ അവരുടെ ഇൽനെസ്സിന്റെ ഒരു പാർട്ടിന്റെ ഒരു ഭാഗമാണ് എന്നൊക്കെ ചിലപ്പോൾ തെറ്റിദ്ധരിച്ചിരിക്കാം. പക്ഷേ വാസ്തവത്തിൽ അത് ഡിപ്രഷൻ കൊണ്ടുണ്ടാവുന്ന ഒരു കണ്ടീഷനാണ്. അത് unless you specifically screen for them, we may not realize that depression is the underlying cause of all these problems. And it's also a risk factor. It's a risk factor for cognitive dysfunction too. And so depression screen ചെയ്യാനായിട്ടും ഇതുപോലെ തന്നെ പല screening tools ഉണ്ട്. And it's called, like in general practice, most of the time there's a 9-question screening tool which is called PHQ-9. That's what we usually use. But in the elderly population, there is another screening tool called the geriatric depression scale, which is kind of a yes or no questions on. So people with having cognitive dysfunction, they may fare better with the geriatric depression scale screening. So if you find if you have some patients with depression, we can treat them with several methods, like non-pharmacological or pharmacological either. But most of the time, in the elderly population, they will require medications, compared to the younger population, which younger population may fare better with the other non-pharmacological methods like cognitive behavioral therapy and other counseling and everything. And the other important thing that we need to be very aware about, like vision screening and hearing. And usually US Preventive Task Force, that it doesn't recommend routine screening for vision or hearing, but we have to be very careful, we have to be very vigilant about these conditions. Very often patients പലപ്പോഴും പറയാറില്ല. പലപ്പോഴും ഇപ്പോൾ ഉദാഹരണത്തിന് ഹിയറിംഗ് ആണെങ്കിൽ they may not be able to, they sometimes may not be forthcoming with their problems. Like if we may have to ask questions about hearing, sometimes അവരുടെ സ്പൗസോ അല്ലെങ്കിൽ ചിൽഡ്രൻ ആയിരിക്കും ചിലപ്പോൾ കൂടുതലും അത് ഡിറ്റക്ട് ചെയ്യുക. അപ്പോൾ ചിലപ്പോൾ അവർ ഹിസ്റ്ററി എടുക്കുമ്പോൾ പലപ്പോഴും ചിലപ്പോൾ പേഷ്യൻ്റ് മാത്രമല്ല അവരുടെ ഫാമിലി മെമ്പേഴ്സിനോടും ചിലപ്പോൾ they may be able to give more information in such cases. Usual causes for vision problems in the elderly are like usually cataracts, glaucoma, macular degeneration. These are the conditions. And if they have other conditions like diabetes, hypertension, that itself can cause changes in the vision, and that can contribute to vision loss too. So all these things needs to be carefully looked at, and if we find something, early referral, which is very important.
Right. Wow. That was a lot of information, and just makes me, and I guess everybody else, also really nervous about getting old, right? It's not doesn't look like it's fun. But I also want to ask you, doctor, I don't know if you mentioned that already, but I may have missed it. So what is the right doctor is to really go to a doctor who is like yourself, who specializes in geriatric medicine, or is it okay to even go to an internal medicine? And how often do you, would you recommend that people older 65 and above, how often should they be seeing a doctor?
Well, most of these things, any internist or, you don't really need a geriatrician to do all these things. Actually, most of the things, even under the general internal medicine, they can do many of these things, and geriatrics patient, there are certain things, they may require geriatricians, like, certain, nowadays, there are, certain, which is actually one of the things, like, the newer medications, like, for example, like, in Alzheimer's dementia, there are newer medications which is available, like, it's not a game-changing drug, but, there are certain things, which, requires, either, treatment from a geriatric medicine, like, there is a newer medication which is available, it's only given through IV, and certain in those medications, you may need to have some treatment, and that needs to be certified by a geriatrician or a neurologist or any specialist, but most of the things, any geriatric, any primary care, say, you can do in primary care setting,
Mm-hmm. Okay,
Yeah.
I think that's helpful to know. And
Yeah.
then in relation to, everything that you just said, right, about all the preventative screening and all the different kinds of problems that they can experience, are there some tips that you could give to this population at, what they can do, or before, like, even younger population, what are some things that they can do to remain healthier and to kind of limit all those problems that usually happens with aging, how to stay fit both mentally and physically? Any tips that you can share?
Well, the main thing is, like, be active and physically active, and that itself will make you, take care of most of the problems, chronic problems, and and as you get older, it's pretty common that you are going to get a lot of, other, conditions, you can have diseases related to the age, like, you can have osteoarthritis, and, that which is, and you can have, as I mentioned earlier, like, changes with vision, changes with hearing. So, you have to be aware about all these things, and make sure that, as you get older, you need to have a regularly scheduled visits to your primary care practitioner. They can examine you and they can detect, any problems, even before it becomes, a problem later in life, So, and again, physical fitness, and eat healthy, maintain a, healthy weight, and these are the things, you can do, to keep you healthy as much as possible.
Yeah, those are great. Some great points that you mentioned, especially about staying physically active, that's so important. And sooner you start, the better, right? So that way you're trying to prevent all those situations from happening.
Yeah.
Thank you, doctor, for that. And now we will shift gears and move on to a slightly different topic related to general health, but a little bit related to sleep. So I want to go to Dr. Shari, and since he's an expert on this topic. Dr. Shari, hi, thank you for being with us today, first of all. And then I want to ask you, how important is sleep for optimal health? And could you tell us something about sleep apnea that these days we seem to be hearing a lot about?
Thanks. I think so sleep is the root cause of all these problems in our body. If you don't have a good sleep, all this problem starts. So what is sleep apnea? It's a sleep disorder in which breathing repeatedly stops and starts. And the main type is obstructive sleep apnea. So what are the signs and symptoms of sleep apnea? I think so it's loud snoring. That's the number one that you can hear. A lot of patients from in the southern world or southern countries or even Middle Eastern countries or even Asia, we see this condition increasing. And why is this? That's like a lot of documentation now that shows why this is happening. So the signs and symptoms, one is loud snoring, episode in which you stop breathing during sleep. So that's one of the main concern. And also during sleep, you're grasping for air. And this causes dry mouth, then also causes morning headaches. Some patients cannot have very difficulty in sleeping at night. And some people will sleep during the daytime. So these are some of the common signs and symptoms. And also like when you sit in a car, you'll be driving, the passenger will be snoring. This is another, what you call, sign. Also you'll be watching TV. The TV will be running, but you're snoring. So these are all tiredness that because you cannot sleep at night. What are the risk factors? Risk factors are like excessive weight. That means patients who are obese. That's one. Then family history. People who consume a lot of alcohol, sedatives, smoking. All this also causes risk factors for sleep apnea. Some of the medical conditions that could cause the sleep apnea is congestive heart failure. You could also high blood pressure, type 2 diabetes, and there's many other factors that could cause medical conditions. So what do we do? I think so when you hear loud snoring voices, that's a serious condition. So that means that's when you have to consult with your PCP or a pulmonologist or your cardiologist when you feel that this is a condition, a situation. Then what they will do a sleep apnea test. It's called, so you are going to their office or there's an appliance that you can take home and they put it on your body and see how much time you stop breathing at night and then grasp for air. And they calculate all those things and they consider it as a mild, moderate, or severe. And that's when they recommend the CPAP machine. It's called the continuous positive airway pressure. That's a machine that you have to wear it at night and that gives air. And your pulmonologist or cardiologist can track all those things. Second thing, what we do as dentists, we make sleep apnea appliance. So that's to bring your jaw forward. So that prevents your tongue falling backwards, which obstructs the airway. So it's all, the problem is the airway. So that's why you have to seek an immediate treatment for this because there are reported death because of obstructive, there's no air going to the brain and all those things. So this is a serious condition. So when you hear loud snoring voices, that's an indication that you need to seek advice with your PCP or pulmonologist or cardiologist.
Wow, that's a lot of information, and thank you. That's like really very, very educational. I mean, I didn't know a lot of these things myself. So one of the things I wanted to ask, Doctor, was you mentioned like loud snoring is one of the main right symptoms. So is it possible for somebody to have sleep apnea even if they're snoring, if they don't snore?
They could have, you could be having tiredness. Like let's say when you even you could see it in pediatric patients, like kids could also have sleep apnea. So you can see a kid, like you put it in a straight in a bed, but in the morning, the kid will be all the way around in the opposite direction. So that means the kid is also having sleep apnea, cannot breathe, tiredness. So they cannot sleep. So that's why when they get up in the morning, they're too tired. So you could have it in different forms. You don't have to snore. You could have other conditions also, obstructive thing you could have. So there's different ways that you can have sleep apnea.
So fatigue can be one of the
Fatigue
causes,
is also
symptoms.
yeah.
Okay. Wow, thank you for that knowledge there. But since I have you here, I also want to ask you something in relation to routine dental care. Can you give us or share with us what can be some serious medical consequences of not getting routine dental care, on a regular basis?
I think so. If you have poor oral health condition, also is another situation where you can have a lot of problems in your system. Everybody thinks 32 teeth is only a number, but there are other conditions that's related to your teeth, which could cause infections because it's all bacteria. Your mouth is full of bacteria. So that's the root cause of all the other problems in your body, which could cause even cardiovascular disease, cancer, pneumonia, birth complication, diabetes, kidney disease, high blood pressure. So there's a lot of correlation between oral health to other parts of the body. That means you have to have the gum issue is one of the main factors. I think so we try to neglect. They think it's only 32 teeth and the gum, but gums are the most important critical part. And cancer of the mouth is also another major factor. The thing is, even cancers are silent in the oral cavity, which can spread to other parts of the body, especially on the sides of the tongue and other areas. So oral health is very important, which we try to neglect. But I hope nowadays everybody's like thinking about it. Like after COVID, there's a massive increase in poor oral health conditions, a lot of infections, a lot of fractures since COVID.
What do you think, doctor, is the reason for that?
That means you're sitting at home and eating all the thing and not visiting your dentist periodically.
Okay, not brushing teeth, huh? I mean, I would think that they are home, they should have more time to brush their teeth.
Yeah, but since you're at home, you have nothing else to do. You got other things to do instead of brushing your teeth.
Right, that's really such an that's so interesting that you're actually seeing a rise in all those conditions. What is like a regular amount of time that or how frequently would you recommend somebody go to a dentist?
I think so you have to at least go twice a year, but it all depends upon situations. I usually recommend patients with severe gingivitis or periodontitis do at least every 3 times a year because periodontal health is very important and you don't have any pain. So this is another reason why a lot of people don't go to the dentist. You don't have any pain, and the pain comes at the last stage. That's when we run to the dentist. But if you make it a point that you do visit at least 3 to 4 times a year, it's a preventive care. You don't want to go to us an emergency care. So at least 3 times a year, depending upon the situation. And that's what I recommend.
That's good to know. Thank you. So just you kind of mentioned or touched upon this, but I also wanted to ask you if there are some special care tips that you would recommend specifically for children and teens to maintain healthy teeth and gums.
I think pediatric cases, I think so we tend to neglect a lot because in this day and age, it's full of sugar, carbohydrates, everything. And they are having like sugar, everywhere is sugar. So I recommend like brush twice daily, floss, fluoride, and take the kids to yeah, pediatric dentist at least every 6 months, and flossing, and cut down what you call sugary diet. I think so. It's all diet, and we see an increase in caries lesion among primary care and from pediatric patients. A lot of kids having a lot of caries lesions nowadays.
What does that mean, doctor?
That means decay of the tooth. That's because the baby teeth are very soft and you can get cavities so fast. And that leads to pain. And then that leads to extraction, which you don't want to extract teeth more rapidly than the normal time, because that causes other orthodontic problems. So it's all like a, what do you call that, like domino effect. One triggers the other one.
Right. Great. Thank you for sharing all these tips and wealth of information with us. Thank you. And now we'll move on to the mental health segment. But before that, I just wanted to take a quick peek at the chat box and see what's happening there. Are people getting the answers for the trivia? Okay, looks like there are some jokes going on too. Good. I'm glad people are enjoying. All right. So, Dr. Saira, I think coming on to you again, I wanted to specifically, again, we've all kind of talked a little bit about this, but again, specifically wanted to talk to you about the increase in anxiety, depression, and other mental health disorders since the pandemic started. And have you also seen that in your practice and in your experience, that there has been an increase in that? And then related to that, a very hard question actually related to that is, as a country, do you think we are adequately staffed to handle that?
It's a very relevant, important, loaded question. So to start off, worries and anxiety about COVID-19 and the impact can be very overwhelming. And in the pandemic, the social distancing made it even more challenging. So as it is I work with veterans, a very vulnerable group of people with very high mental health illnesses, PTSD and things like that. So as it is, even prior to the pandemic, we were not, as a whole country, we were not adequately staffed to take care of their needs, let alone now when everything has surged so many folds, threefold, fourfold, the mental health illnesses. So what happened is the pandemic brought so many changes in your life. Everything changed. So you're so uncertain. Your altered daily routines. We don't know tomorrow you have your job or not, financial pressures, and you're not seeing your friends, social isolation, everything together. And you don't know every day so many rumors about this, about the virus, the vaccine, its effects. So much of information, misinformation, you don't know what to believe, people are all confused. And they feel out of place, don't know. And as it is, for people who have mental illness, to start off with depression, anxiety, it increased. For those who had low level and was not, they surfaced. And for people, others, it came up. So overall, it was a very tough situation. So even for children, they had interaction, go to school and everything. All of a sudden, they're restricted to their house and their homes and just the gadgets alone and no interaction. And overall, the whole situation, mental health wise, has deteriorated terribly. And even though, just as I mentioned previously, the mask and things have improved, the mental health and the problems, they are improving, but has not done at an equal pace, and the stress and everything and the depression and the anxiety which started off or increased as a result of the COVID is still there. And that's where the importance of learning strategies to combat it becomes important. So to start off with, everything is immediately when you have that run to the doctor, take medications. No, that is not what it is. Unlike other infections or anything like that, there are other strategies on which we should first focus to handle. So first of all, self-care strategies. So by that, I mean, self-care, it is both your body and your mind. So when it comes to your body, certain things which can make your depression, anxiety, and those illnesses worse is lack of sleep. So get enough good sleep. Just Dr. Shari just mentioned about, sleep apnea. So untreated sleep apnea, some of the features of untreated sleep apnea is fatigue, insomnia, and people, they drive, they doze off behind the wheel, those kind of, and that can lead to arrhythmias, high blood pressure, and so right heart failure and whatnot. So get enough good sleep. And then the next is participate in regular physical activity. You don't have to do heavy lifting or things like that. Small activity, just walking, exercises, those kind of regular physical activity, that's important. Then eat healthy, a good nutritious diet. That is very important. Then again, avoid tobacco, alcohol, and drugs. People had the impression that, I'm depressed, anxious, let me drink more, and let me do drugs and things like that, thinking that will be able to combat. Many of my patients, they tell me, Dr. Matthews, what have we got to do at home? We have nothing to do. And don't tell me that is only one good thing I'm able to do. I'm drinking more, I'm smoking more, But what happened after this thing? The rates of other illnesses and everything is gone. And they did this to try to combat their depression and anxiety, but as it had a negative effect, it only got worse. They become so, and also bear in mind, addiction, be it drug, alcohol, anything, it decreases your immunity to fight the COVID illness. So again, there also it has a negative impact. Then other thing you have to do is to limit the screen time. Many a time we are forced to be with the screen, but then you should set a limit to it because, that is also an addiction kind of thing. And then you need a break from it. Relax and recharge. That is, you set some time aside for yourself. Especially we females, we need to have the me time. It need not be hours. It can be just 10 minutes, 15 minutes, but make sure to set aside that time to do something which you enjoy, which you like. Maybe take a bath in the jacuzzi or a bubble bath, or just take a walk. Or if not, just close your eyes and listen to some music or something. Each one of us, the kids, or take some me time and recharge yourself. And you can do yoga, meditation, and whatever makes you happy. And again, do it, all these things on a regular basis. Having a routine itself is very effective. That itself relaxes you. This is for the body. Then you have to take care of these are things which you have to do for yourself. Try before trying other measures. The other thing is take care of your mind. Again, there, keep a regular routine. So knowing that I get up, I have some chores to do, and then after that I will be doing work, and then I will be doing that, and then eating, exercising, having that regular routine, that itself is, instead of chaos, this is very relaxing. Then limit exposure to news media. That is very important. You hear something, oh, this COVID-19, if you take the vaccine, it will happen, if that happens, and all those kind of misinformation will confuse you. That's when you have to depend on reliable sources like CDC and WHO and limit there. Don't go elsewhere and try to be Google doctor, that happens, and then we get confused here. Then the other thing what you can do is stay busy. Find something, a purpose. They say, right, the idle mind is a devil's workshop. When you have nothing to do, all the negative thoughts come to you, and then you cannot focus, you get upset and anxiety, and then anxiety feeds anxiety. It gets only worse. Then other thing you can do is focus on positive thoughts. So getting up in the morning, you can say, count your blessings, thankful. In this day and age, millions of people have died. You being alive itself is a blessing. So count your blessings. Be thankful for the small little things. That itself will create a positive impact on you and help you get going. And then use your moral compass or a spiritual life. If you are a religious person, you can turn to your spiritual leaders or the holy books, the Bhagavad Gita, the Quran, the Bible. There also some people get a lot of positivity to combat all these things. And other thing you can do is set priorities. Okay, it's a COVID, I want to do that. And then, when you're not able to do, you get upset, worried, anxious. So set goals, set smart goals, goals which are achievable. And even if you're able to do small things, you give credit to it. The other thing you can do is contact with others. Making connections, that itself will help. Call your, now it's this time of social media, you can get through emails, texts, phone, Zoom, whatever, connect with somebody close to you, your friend, family, and find out how they are doing, talking to them, being able to assess them, and knowing sometimes, you realize our problem is the greatest problem, but when you listen to somebody, you realize, oh, ours is nothing. Parayalo, ആനയ്ക്ക് തടിഭാരം, ഉറുമ്പിന് അരിഭാരം. അപ്പൊ എല്ലാവർക്കും ഉണ്ട്. അപ്പൊ നമുക്ക് മനസ്സിലാവും ours is nothing compared to അങ്ങനെ. അപ്പം the other thing what you can do is do something for others, helping, the joy of giving, the joy of helping others. അപ്പൊ നമുക്ക് എന്തെങ്കിലും മറ്റുള്ളവർക്ക് ചെയ്തു കൊടുത്താൽ making a small difference, just being able to bring a smile on their face, എന്തെങ്കിലും ഒരു ചെറിയ കാര്യം, അതാണെങ്കിൽ ആ മനസ്സിരുത്തി അവരൊരു താങ്ക് യു, യോ ആരും എനിക്ക് ചെയ്തില്ല, യോ താങ്ക് യു വെരി മച്ച്, അത് മതി. That itself, it stimulates all the feel good hormones in our body and chemical, അങ്ങനെ it helps a lot. You can support, just as men support a family member or friend or anything. പിന്നെ ഇതൊക്കെ കഴിഞ്ഞാലും still we are very, you get this anxiety, so you're not able to sleep, not able to eat, you're anxious, you cannot focus on your work, അങ്ങനെ ഭയങ്കരമായിട്ട് ഇതൊക്കെ after several days of all this is continuing, you tried all your self strategies, ഒന്നും work ചെയ്യുന്നില്ലെങ്കിൽ, then don't hang on to it. That is time when you have to reach out to help. Understand that you have to ask for help, understand it's a problem which is a little more serious than which you can handle. Up you have to seek help. So call your primary care doctor, or you can go to like a therapist. ഉടനെ ചാടിക്കറി മരുന്നിന്റെ ആവശ്യമില്ല. You go to a therapist, or then that's when they can help you. And there are many organizations. Okay, suicidal aanu, they have the 1-800-TALK 273 TALK suicide line under. Appo anganokkeയാണ് seek help. The therapist will help you, cognitive behavior therapy, and their organizations ella. Sometimes adukondum pattathillengi, you need chemical imbalance, of course you need medications. Ippam nammada community especially, they have the stigma, mental illness. Ipo namukku oru cold cough ayo, I have a cold cough, appam antibiotics kaichu, ella I'm feeling pneumonia, allengi I have a heart attack, adonnu kuഴപ്പമില്ല. പക്ഷേ എനിക്ക് ഡിപ്രഷൻ, ആങ്സൈറ്റി, ആരോടും പറയല്ലേ, യോ വിചാരിക്കും. That nammada, even now, the stigma is still there. So we need to realize that just as the body gets ill, the mind gets ill. You have to come up, and when you need help, and there is solution in ella undu. So it is just a transient thing, and if you don't give them the help in the needed time, the സൂചി കൊണ്ട് എടുക്കണ്ടേ, തുമ്പ കൊണ്ട് അങ്ങനെ അതുപോലെ. So early intervention is very important. പിന്നെ you should recognize what's typical and not. In the which you have to seek help. Pretty much this is what it is, and you should all understand that. Just as I mentioned initially, we can try all these self-care strategies and stepwise all this kind of things, and then in spite of, unlike mask അറിയാം അത് ഇതാ എല്ലാം ആയാലും, ഈ കോവിഡ് ഉണ്ടാക്കിയ സ്ട്രെസ്സും ആങ്സൈറ്റി അതിന്റെ എല്ലാം ഇമ്പാക്ട് ഇപ്പോഴും മുഴുവൻ പോയിട്ടില്ല. ആൻഡ് മെനി ഓഫ് ദോസ് things that be it self-care strategies or anything, you should hang on to it, because ഒറ്റ മനുഷ്യരുടെ ലൈഫിലും the stress is not going to go away. It will only come more and more different kinds, but learning strategies to help combat it, by that itself you're a winner. And by saying that, okay, physically your parameters, the blood work excellent, blood pressure excellent, but if you're mentally unstable, there's nothing. But that's the importance of whole health. Totally I'm healthy nu parna, mind and body should be healthy, ennale ullu. And we all know, right, healthy mind in a healthy body, and it's very important. And just like Indira mentioned initially, health is the greatest asset. 1 minute polum
It's like we're having some problems with...
all the
Okay.
So we should all focus on our health, both mind and body, and that is to say the importance of mental health.
Terrific. Thank you so much, Dr. Saira, for that comprehensive, really, really good, thorough tips there. I enjoyed all the things that you talked about. There's so many different, things, strategies you talked about. The things that really, the ones that really I like the most are like self-care that you said, that really do self-care, take the time to take care of yourself and give yourself some time. And also that point that you made about kind of doing a routine, setting up a routine. And especially in this COVID era, things have become more chaotic and people have kind of, their regular routine has kind of gotten disrupted. So kind of getting back into the routine, I think that's a great recommendation too. And yeah, everything basically that you said is makes a lot of sense. And you also talked about making connections, and and that's a little bit hard physically in the COVID world. Hopefully things are getting better, but even if there is social distancing, we can still try to do things and stay connected. Thankfully, due to all the technological advances that we have, Zoom has, thankfully helped us with that. So thank you again, Dr. Saira. And now I'm going to go to Dr. Remy. On the same topic, Dr. Remy, I wanted to ask you, and Dr. Saira also kind of touched upon this a little bit, but I wanted to get your take on what do you think about increased media exposure, especially the phone, computer, and video games. It's a really hard world, right? On one side, we have COVID, so we can't do all the things that we really enjoy doing, going out and, meeting friends, etc. So we have to resort to media. But do you think that, this increased media exposure in the last 2 years, especially for teens and young adults, do you think that could be one of the causes for increased behavioral or mental health problems?
This is like $1 million question because screen time addiction is a big deal. And we know, നമ്മൾ വളർന്ന സമയത്തൊക്കെ വെളിയിൽ പോയി കളിക്കുകയും ആൾക്കാരോട് മിങ്കിൾ ചെയ്യുകയും എക്സ്റ്റെൻഡഡ് ഫാമിലിയുടെ കൂടെ ഡിന്നർ കഴിക്കുകയും at this time we're all kind of secluded in our own homes, smaller families, and screen time is actually a screen time addiction. You could call it that. And the relationship between screen time and mood disorders, there's a lot of correlation. ഇപ്പൊ എല്ലാവർക്കും phone access ഉണ്ട്, and a lot of them are on it multiple times throughout the day till they sleep. Okay, some of it is good, like Zoom platform, we're all working, that's okay. But things like, so a lot of social media, interactive video games, all these can help kids to an extent to, alleviate their boredom, but too much of it is not appropriate at all. And it can negatively affect their health, like their sleep, their attention span, learning, their mood, their weight. And these teenagers, the young adults who are driving, texting and driving, accidents, death, it's a big deal. And another thing about screen time and all these social medias, it compromises their personal privacy. They reveal inaccurate content and unsafe contacts in these younger children. There has to be a close watch on what your kids are watching. How long are they on their screen time? Are they taking this phone to their bed? We all as parents and adults have to keep a close watch, and us ourselves, we have to set examples. We're also on our phone a lot of times, and we are setting examples. So we have to really make it a point to sit with the kids and discuss. And one good thing would be to have family time, have dinner together, discuss issues at school, and do things like maybe hiking, walking together as a family, doing things together as a family, and getting to know what your kids are actually involved in. Because when they get to teenagers, most of the time they're spending in their rooms and you really don't know exactly what they're doing. Which can be detrimental to their health and their education and mental issues as well. So I have a few suggestions for discussing social media use with adolescents. Which social media sites are your kids using? You really need to keep a watch, and you need to check for the privacy settings. We should have a family media plan. There's certain ways you need to know what these kids are watching at all times. Who they are chatting with, what kind of social media are your kids on? Are they on TikTok, Facebook, there's Instagram? There's so many things available out there. How long do you spend on social media in a typical day? Under 2 years, they should have no screen time, 0 screen time below 2 years of age. Between 2 to 5, 1 hour per day, and 5 to 17, 1 to 2 hours per day. Itre ullu, what they're telling us to use, but of course, a lot of us are using way beyond. And do you think your use of social media is too much? You can see the kids are all into their phones and not able to even communicate with an elder or another person coming to your house. They'll come and say hi and they'll walk off and be in their room. No, they should sit down and talk to your friends or whoever is coming into the house. And does viewing social media cause you stress? There's so much out there in the media that even young girls, they're looking at this. Oh, you're supposed to have a certain look, you're supposed to look like this, you're supposed to look like that. That even changes their mind and attitude towards how they are supposed to be presenting themselves in the community. And do you use electronic media before bed? Avoid all electronic devices, including TV, in the bedroom, and you have to avoid screen exposure at least 1 hour before bedtime, which is important. And also our kids, is there cyberbullying? Is there online inappropriate content being shared by these kids? These are all important, very important for us as adults to keep a watch on our children. And there are certain risk factors for depression in children and adolescents. There's a lot of risk factors, and one of them is internet gaming and video game addiction. That is a major risk factor for depression in children and adolescents, and which can lead to low self-esteem, lack of kindness, being angry, disrespectful, having academic issues, not doing well in school. These are all the things that we should keep a watch. When you see all these things happening to your kid, you should, take a step back and see what is happening and try to limit things, that these children can be obsessed with these things. And when you visit with your kid, to a pediatrician, the American Academy of Pediatricians, they actually keep a watch about 12 years of age. They recommend screening all adolescents about 12 years of age for an annual depression screening, because a lot of kids have depression, underlying depression that maybe you don't see it. Idellam internetum adum idum, not communicating with your friends or adults who might be able to help you, rather than they seek to the internet. And the end, when everything, all hell breaks loose, kids do certain drastic things in life, which, at the end, us as parents will regret. So in terms of relationship between screen use and physical and mental health outcomes, there have been so many studies done. And they're saying that higher levels of screen use in children and adolescents is associated with less physical activity, increased risk of depression, and lower well-being. So studies have been done, and it is definite, and we know that, screen time reduces, the children being exposed to other healthy things, right? Okay, limit the screen time to 1 to 2 hours. Let's get out and play. Let's get an activity that's good for you. You like karate, you like dancing, you like singing. Get the kids out to so many activities that they'll be involved in and be happy that they're not sitting at home and just being on the internet. Especially with COVID, there was nothing better to do other than being stuck at home. And even when they're studying, you really think they were studying at some point? Some people, while they're on Zoom, they're watching other things, So these are the things that we have to keep a watch. Insufficient sleep, they're not sleeping well. Delayed sleep-wake behavior and sleep disturbances are also among the problems that can happen with too much of screen time. Ellam kondum, it will cause school problems. Kids get angry, aggression, frustration, depression, and emotional problems. Even if a parent will ask some question, how was your day at school? Some of them will answer two lines and they're done, or not even a line, because they're going to run back and go watch whatever they're interested in, So we have to have parent time, sit together and eat as a family, all these things. Movie time, where you're sitting together as a family and watching things, which will increase the kids to come to you and ask for help if they need, and not seek help from the internet. And distractions, obviously, delayed physical activity can cause obesity and then health problems as an adult. So anxiety, depression, ellam, screen time, it can happen.
So many problems, right, related
Yes.
to just the increased screen time. And you made such great points about, so many things and so many suggestions. One of the biggest things you said was to try and reduce their screen time to 1.5 to 2 hours, right? Do you have any suggestions for the parents in terms of how they can implement that in practice, right? Because as a parent that is of teenagers, that's one of the hardest thing I think, I'm struggling with myself. And as you said, it's not just the kids, right? We adults are also actually becoming addicted to our phones. So in our family, I'm trying to do my best, at least to set that role, kind of an example, and trying to reduce my screen time. But are there any other innovative strategies that you can give us some tips on what we can do to get the kids away from the phone and the media?
Getting them, there's no quick fix to it, but, getting them involved in other activities, putting the phone away, maybe putting the phone down in the living room and having them go back and sleep. You're not having your phone for the night, and, it may be a hard,
maybe they can put it to charging
put it to
in
charge
the living
downstairs, when you're eating, you're not using the phone. Slowly change it. You can't change the behavior overnight. You slowly change the behavior, that way they can, so they're not, of course, initially they're going to be angry with you, but,
Right.
once you slowly change, why don't you read a book? Why don't you, do some social activities like Dr. Sarah was saying, have them involved in community activities, obviously depending on the COVID level, have them involved in different things, that they can do to help the community, things like that, that they can maybe volunteer for something, adolescents, they can get a job once on the weekend, maybe work a couple of hours. Things like that will help them become more responsible and understand how life is. And rather than just, us enabling them and, us watching the screen 24 hours and them watching. So then, when you tell your child, they're like, oh yeah, you're watching it too, Sometimes when I tell my daughter, she'll be like, oh, mommy, you're watching it too.
Right.
So
we definitely have to watch ourselves.
I have
Right.
to improve myself as well, to limit screen time.
Yeah, to set that example. That's so true. And I like your point about, doing it gradually. Maybe, you can't expect overnight change, but just continually, giving that message, relaying that message, and maybe gradually, they can see that difference. And as kids get older, one of the things is they need to get that realization themselves too, right? That's one of the things I feel like they need to get that realization themselves too, that things are not right. And somehow, if we can put that into their heads, maybe things will change.
Help out in the house, help their parents, put the trash out, everybody take turns to clean the dishes one night, get them involved in family stuff that will also help, rather than the dad and mom doing everything for them, little things.
Right. Those are some great points, Dr. Remy. Thank you so much for sharing that with us. All right, so we will, again, moving on to the same topic and just related, I wanted to reach out to Dr. Suchitra with her experience, wanted to ask her, what in relation to anxiety and depression, what kinds of therapies are currently available? I know Dr. Saira mentioned a little bit about that. But can you, just kind of talk to us about the therapies and then how one can go about finding the right therapist for themselves or their children?
So like she said, when we do start talking about the treatment for the depression and anxiety, there is a stigma in our society, especially in our population, which is associated with like mental health issues. But again, it's important to stress it should be like any other illness, like diabetes or hypertension, of course, and it is like slowly changing in our population too. So after trying the various methods, like she said, the healthy lifestyle, including exercise, the relaxation techniques, the breathing exercises. If they don't work, a lot of people will still need a little bit more help. And that's when seeing a psychologist or a therapist or a psychiatrist, or even your a PCP, and start having a discussion to see if medications are needed, it'll help. So as it is, it was a bit challenging to find a mental health provider even before this time of COVID. And right now it's become even more difficult. But there are still some options. One is if you do have insurance, and if you call your insurance provider, they should be able to give you a list of providers that's approved. Otherwise, there are various websites to look for a therapist, like psychologytoday.com. It's a very good website. Other option is there are these clinics called the Wheeler Clinic. They have centers in Hartford, Plainville, etc. And they actually do a walk-in intake. So if you go there like early in the morning, it's basically first come, first served. So that's an option. Another option is you can even call the 211 number, or the 211ct.org is actually a very good resource. They have options for crisis service, like mental health hotlines, including like hotlines for a suicide prevention hotline. So it's actually a very good like resource. So these are the few like options that people can try.
That's great. Thank you so much, especially for, calling out those examples of resources, the websites, because as you said, in the, post-COVID, there has been really a surge in these cases, and many people have been saying that it's becoming really harder and harder to find appointments with therapists. And, so thank you for sharing those resources. Thank you so much. All right. So that actually brings us to the end of this segment. And now we will be moving on to our fourth segment, that is the Q&A. But before that, we have a video share from our event sponsor, who is Kala Prasad. She is the author of the book, Ancient Wisdom for Modern Times, that's available on Amazon. And Kala was kind enough to send us a video, so we will play that now. So let's do that.
I would like to congratulate the Kerala Association of Connecticut for this informational session that they have planned for the community. I'm humbled by the recognition as an author. Yes, I did write the book, Ancient Wisdom for Modern Times. What started as taking notes while reading has taken the form of a book. It is divine intervention that guided me to write. അത് ഭഗവാനന്റെ കൃപ കൊണ്ട് മാത്രമാണ്. Today's topic is ഡോക്ടറോട് ചോദിക്കാം. ഡോക്ടറോട് ചോദിക്കുന്നത് വളരെ അത്യാവശ്യമാണ്. We have our doctors here educating us on the importance of our physical well-being, and I take this opportunity to stress upon the importance of our spiritual well-being. Spirituality may not be able to cure physical ailments, but it can help to cope with the pain and difficulties that accompany illness. Bhagavad Gita is a spiritual text and is a perfect guide for healthy and happy living. The Gita provides several options to pursue, be it the path of action, devotion, meditation, or knowledge. The message of the Gita is time immemorial, and the book, Ancient Wisdom for Modern Times, is a brief synopsis highlighting the quintessence of the Gita. The message has been reinforced through repetitive guidance, and we gain insight in understanding the practical application of these spiritual teachings in our daily lives. Spirituality is a personal experience, and a spiritual lifestyle is a blissful lifestyle. This is a wonderful platform that has been created by Kerala Association of Connecticut, calling it Doctorodu Chodikkam. And I leave you with this message. Ade, Doctorodu Chodichu മനസ്സിലാക്കുന്നത് വളരെ അത്യാവശ്യമാണ്.
That was such a wonderful and sweet message by Mrs. Kala. All right, so now let's move on to the live Q&A. Looking through to see what questions. We do have a few questions, and there is still time, folks, to submit your question. So now there is a question, okay, that is from Priya. She is asking, this summer, a lot of people are planning to travel, but are still worried and hesitant. What precautions can you suggest before traveling? So this is, a very important question. I think any doctor who's particularly interested in answering this, you can raise your hands and hopefully I'll be able to see here.
I can answer that for you.
Okay, great. Dr. Remy.
So traveling, we've been stuck at home for the past 2 years. I think people should travel, get out there and, VT Kutirina, 2 varshamayitte, you need to visit your family back home or just do a pleasure trip. People should travel like how they've traveled in the past, except that, you just need to take precautions, wear a mask while on flight and in the airport, because those are busy areas where, things can spread, even not necessarily COVID, just even other viral illnesses, but especially with COVID being there and being on flight, it's a small area where air is being circulated and, wearing a mask, you've taken all your vaccines, that's extra protection. And, use your hand washing, use your protection that you use usually when you go use the bathroom, wash your hands. Alcohol-based wipes or alcohol-based solutions that you can use. Pretty much, and certain travel things, I think you'll have to fill out certain forms if you're traveling to certain countries, and taking a COVID test prior to coming to the United States. And now I think they've uplifted that, taking the COVID test prior to traveling to, it depends on the country you're traveling as well, to India, I don't think you need a COVID test to be done prior to travel. Rather than, people should feel comfortable traveling, wear your masks and hand hygiene. And especially when you're traveling to a country that you're kind of careful, especially Kerala or other Indian countries, you want to eat where things are cooked properly, boiled water or, things like that. Like we take precautions anytime we travel. And of course, if there's increased mosquitoes and other dengue fever and things like that, take mosquito repellents, wear long, clothes, like long shirts and tights and stuff like that for kids. So they prevent, that much mosquito bites and things like that. And you drink proper water, eat food that is reliable is what I would suggest. But traveling shouldn't be an issue.
So what you're saying, Dr. Remy, is basically like kind of take all the common sense precautions that you would normally take, right, in a travel. Okay, that makes a lot of sense.
പണ്ട് ചെയ്തുകൊണ്ടിരുന്നതെല്ലാം ചെയ്യുക, പ്ലസ് ഞാൻ പറഞ്ഞ പോലെ മാസ്ക് എടുത്ത് എറിയാൻ സമയമായില്ല, ആവശ്യമുണ്ട്. അപ്പൊ ഈ certain situations use ചെയ്യേ, but otherwise all the other precautions പണ്ട് ചെയ്ത പോലെ തന്നെ. So
Right. The mask thing is important. Yeah, good point.
That's an additional.
Right. Okay, terrific. So let's see, we have a few more questions here. So there is one question about impact of social media and electronics, but we already covered that in our segment. So I'm not going to, Dr. Remy and Dr. Saira also talked about that. So the next question, actually, this is a very good question here. There is so much focus on virtual or digital primary care these days, either being pushed by providers or by insurance companies in partnership with other virtual primary care startups. What is your take on this as a traditional provider? Good and bad for patients and for providers. I guess, yeah, this question was submitted by Mahesh, and he wants to know whether, he wants to know both sides of this, for patients as well as providers about digital primary care.
I can answer.
Sure.
Just as the question says, it has like two sides of a coin, both good and bad. The good thing is, if you want, you have a sudden thing, some problem, and you want you have a rush or something, you want your doctor to see. When you call the office, there is no opening. What do? You are just, with the advent of this tele video and so we have an appointment. We can see the rash. We cannot touch, we cannot feel pakshe, we can see the rash. Maybe it's just a mild dermatitis. Okay, we just send a steroid cream. Allengi something poison ivy pole, you need oral steroids, we can send it. Adu alla, like the other day, patient parnyo, I have a rash. Pakshe, when I did the video and the thing, it was actually, was hanging on to it and was like an abscess. So I told him, you have to come in, we have to lance it, you might need IV antibiotics, abscess ana. It's different. So the good thing is, we have the access kudalonde, we can see them, and then if needed, we can bring them to the office. If not, other things. Otherwise, these people would have just, appointment kittunnilla, ER because it is 4 or 5 hour ways. Wait in the bun, and finally it becomes very bad. The bad thing is, there are some people who don't want to come to the clinic at all. Why to bother? Even for a routine yearly physical but many a time we pick up many things during a routine physical. If a patient, how am I feeling good? Everything is fine. I just feel dizzy once in a while. So the other day, I conducted, so I asked him to come. He told me mild dizziness. But when I auscultated, I found a new murmur. I sent him for an echo. It was a critical aortic stenosis. Immediately, cardiology saw and arranged for a surgery. Another patient, I auscultated his carotids, and there was a critical carotid stenosis, and which he had within surgery. And later on, he said, "I'm so thankful you asked me to come." And then the doctor said it was like more than 90%. I would have ended up with a stroke. So these are the good and the bad points. Before that COVID, we were also kind of apprehensive. Tele video, COVID, we were forced to try that. We had no other option. Slowly we got to used to it. And just as I mentioned, good and bad. Emergent rash and the small things would be enough. Pakshe, you are short of breath, very short of breath, huffing and puffing, Allengi, auscultation patatilla. And then nowadays they do have those gadgets when they can, do their own measurements, pulse ox, even auscultation. You can listen to that video wise, but it's a little high tech, and these old patients might not be able. But again, for emergent cases, there are simple things, it's useful. And also it will help us determine whether this needs to be seen personally, we need to do anything versus which and wait. But of course, I would recommend the annual physical exam. It should be a face-to-face and a real touch feel. And many a time, some patients, irrespective, they want that, they feel, we do a visit video, doctor, when do we see you again? When do we have a visit? what did we do now? But they're not happy. Or when they feel, listen, we'll come up with more things. So it's like an individual thing, just as I mentioned, good and bad. So that's what I would say.
I agree with Dr. Saira. And another thing also I noticed with these telehealth versus appointments, our appointment every 20 or half an hour. This telehealth telehealth is done. And I feel like you're not getting that much. Fund patients, 3 questions. Telehealth room, they have written questions and they will have like problem. I feel like with telehealth, because they feel yeah, I know. So it's like I feel 10 minutes or 15 minutes telehealth is done. I feel that face-to-face, like Saira said, and physical exam is critical in older patients, and examining their blood pressure, listening to their heart, checking their feet, diabetes, okay, a lot of feet for numbness, tingling, and even older patients, I'm sure Dr. Verma will say, because older patients, they want that, physically coming in and talking to their provider, and some older patients cannot come in, then it's okay. Telehealth is okay for them. But I feel a lot of things are missed, and that art of medicine is gone with telehealth. Personally, that's what I would say. Certain things can be done by tele, but a lot of things like pre-op. If a pre-op exam, telehealth. I'm sorry, I'm not clearing any patient over the phone for a telehealth other than maybe for a cataract. But Chela you have to physically see it to really examine. Like Sarah was saying about physical exam. You're listening to their belly, feeling their thyroid. What if you miss a lymph node? What if you miss a mass in the abdomen? You need that personal touch to listen and hear. And I feel when you're one-on-one in the room with the patient, you really connect with that patient too, rather than on the telehealth.
So you guys made some great points there, but then part of the question that Mahesh asked is also that the insurance companies are pushing this, right? And so do patients really have a choice here, when they have to go to the telehealth and versus, having to come physically into the office? Do you think that's going to continue to happen, or do you think there's going to be a balance somewhere along the line?
Majority of my patients on Friday, I saw about 20. I had only one telehealth. Obviously, because the COVID cases have come down. We all wear masks in the office, and the patient coming in is also wearing the mask. And while coming in, they're giving an intake form asking if you have any cough, cold, have you taken the vaccine and things like that, And we have the N95 and everything needed if at all, there is a slight concern of COVID, So and insurances should not mandate things like that. I mean, maybe COVID because for COVID, with even the person coming in and telehealth, the provider, that's me, is getting the same bill pretty much, depending on what, I can bill it the same way. So I have not heard of that from patients, honestly, unless maybe during that COVID time, would have been, they were pushing more for tele. But now patients can come in, because we are getting billed the same way.
The telephone and the video but I think video is paid more than the telephone.
Than telephone, exactly.
Okay. And then I work for the VA. It's a patient's desire. Patient decide whether they want to come face to face or tele, or it's their deciding. Insurance doesn't matter. So.
All right, so I think we have come to the end of the section. I'm going to ask one last question just because it looks very interesting. Okay, so this question, Choikkanenu, Doctore, Bhakshanam Karichu Kazhinja Aramanikkooru Kazhiyumba Veendum Veshikkanum. So is there a solution to this problem? Any doctors want to take that?
തമാശയായിട്ട് ഉള്ള ആൻസർ വേണോ അതോ
അല്ല തമാശയിൽ തന്നെ ആൻസർ കൊടുത്താൽ മതി.
തമാശക്ക് ആൻസർ പറയാനാണെങ്കിൽ സലീം കുമാറിന്റെ ഏതെങ്കിലും ഒരു സിനിമ കണ്ടാൽ മതി, എല്ലാം ശരിയായിക്കോളും.
സീരിയസ് ആയിട്ടുള്ള ആൻസർ ആണെങ്കിൽ there are medications to help curb your hunger. So that is something.
All right. Okay, thank you, doctors. So that brings us to the end of this Q&A section. Thank you once again to all the panelists for this wonderful and enlightening discussion, sharing so much information with all of us here. So now I will pass the mic to Ms. Jessie for the vote of thanks. All right. Thank you, everybody.
Wow.
Thank you.
That was such a wonderful, informative session. Hope you all picked up something that related to you. കഴിഞ്ഞ 2 വർഷമായിട്ട് ഈ പാൻഡമിക്കിനെ പറ്റി കേട്ട് നമ്മൾ എല്ലാവരും മടുത്തു. But അതിന്റെ connection with the depression, you all heard from the experts now. So and how it affects our daily life. Thank you, Indira, for being such a wonderful host today. Thank you to all the panelists for taking time to be with us, this big KACT family, and educate us with your expertise. Thanks to addressing some of the taboo subjects like among our community, like mental health. That's like a big taboo among our community. Thanks for touching that. Dr. Suchitra Verma, Dr. Surendran Verma, Dr. Saira Matthews, Dr. Remy Matthews, Dr. Shari Matthew. Ellarudeym expertise കേട്ടു. I think I am affected in all of their fields. I am ill in every field, especially Shari, Dr. Shari's sleep apnea thing. It's close to my heart. I am suffering, but I am taking care of it. But you really educated us on that, Dr. Shari. Thank you. Dr. Sujitra Verma. She mentioned how important it is to follow up on mammogram and pap smear. And Dr. Surendra Verma really touched the aging population, which I don't think nobody wants to hear this, and nobody wants to age, but you did such a good job about how important it is to staying fit and all that you mentioned. Thank you. Dr. Saira Matthews, you mentioned about mask. I was the first one to throw away the mask when the governor lifted the no mask policy, but I will follow your advice. I will keep it handy in my bag, just in case. But thank you for touching about subjects among like anxiety and depression and about the mask. Remy, thank you for mentioning about the screen time and the connection with the addiction and depression and menopause and hormone therapy and everything. But I also have a comment about Dr. Remy's mentioning about, do you know if your kids are studying? I have a personal story that when my son was in university, he went to University of Texas in Austin, and every time you don't see him like, I don't know, 3-4 times a year, that's all you see, and every time he's my baby, so I call him. Every time when I call, he picks up the phone because he knows he will never hear the end of it. So he'll pick up the phone and he'll say, Mom, anything important? I am studying, I'm going to the library. Or he's either going to the library or he's in the library. So thank you for, that gave me a chuckle when you mentioned that. Anyway, last but not least, thanks to the event sponsor, Mrs. Kala Prasad, the author of the book, Ancient Wisdom for Modern Times, for the wonderful video message as well. I would also like to really appreciate and thank the 2022 executive team for their technical support, all the tech team. Thank you so much. Otherwise, it's like, it could have been a disaster without your ഇന്നത്തെ program എല്ലാവരും enjoy ചെയ്തു എന്ന് വിശ്വസിക്കുന്നു അല്ലേ? So we will be coming back soon with interesting programs, activities, and competitions. The next club we're going to introduce is coming up is another exciting online competition by the KACT Arts Sports Club. The club, we just call it club, but it's all the members with similar sports interests. They can, we can get together and share their expertise. We can also plan hiking, biking, running groups, whatever you want, like enjoy a, I don't know, walking by the reservoir or whatever. Dr. Syra mentioned physical activity, how important it is. You don't have to join a gym. You just join the KACT Sports Club. That's all you need to do. We recommend all the members to join KACT clubs to experience its benefits. You can meet with members with similar interests, tips from experts, and pass the information regarding the topic. Our garden club is such a good example for this. It is very useful and informative for the garden lovers in our community. Not much in the wintertime, we don't, not much activities, but we slowly starting to share stuff. The other day, some of our members shared pictures of their plants, flowers. So it is so inspiring for everyone because they want to share it too. When everyone's sharing, you want to share it too. So you start gardening and everything. കഴിഞ്ഞ ദിവസം like some of our members shared pictures of like orchids, and I have like 4 orchid plants. Other than one, none of them rebloom. So I immediately texted her, what do you feed your orchids? Like I was really jealous, and I was like, what do you feed them? So I wanted to learn too, so that kind of attitude, it just keeps you going, and you want to do more and more with the community. And we're planning to have seed exchange. I think some of us in the group already started growing the seeds. I personally started too. Like I got some kandari from another garden club member, and last year I got so much, and I don't know what to do, so I just use it in every dishes, and I get complaints that Mom, it's too hot, but hey, what am I going to do with all these, right? So this is the kind of things that you learn. I got the kandari, and I got some seeds, and I already planted it. So I'm planning to bring it to the seed exchange event, so everyone can suffer like my family suffer, like you just have all the hot dishes. So we're planning to have the seed exchange on April 23rd at Glastonbury Riverfront Park. And we also have a private Facebook group exclusively for KACT members under our Kerala Association of Connecticut official Facebook page. Please request to...
seed ഇല്ലെങ്കിലും വന്ന് മേടിക്കാമോ? Sure. You want some kandari? I have so much in my freezer. Not just kandari, pachamolak, ishtampole ittundu. I'm asking everyone, and nobody wants. So, if please join the club and leave messages like, I want kandari, I want pachamolak, I want pavikai. I even have some pavikai left in the freezer. So it is exciting. Like I learned a lot with the garden club, and you know how passionate I am about when I talk about the garden club. So this is the kind of things, and I am really looking forward to joining the sports club, because I heard someone is running a running group, and I always wanted to, before I turned 50, I'm revealing my age, but before I turned 50, I wanted to run at least a half marathon. It never happened. I am getting closer to the other big number. I'm not saying when. I still have time. So I want to do it before I turn 60. So maybe someone in the group
can help me do that. Who knows? But so this is like, it's really interesting. It's really, you connect to other people in the community and you learn a lot. In this today's event, I learned a lot from all of you, all the doctors. And I don't know how many of our community members know how many doctors are in our community, not just the doctors. There are other highly educated people, highly, talented people like painters and musicians and dancers. And we're a big family. We all came from Kerala, India. And, we're trying to keep up with both cultures, and we can use we can help each other. So that's what I wanted to end it at that note, that we all help each other, be a big community, be connected. So please like and share our Facebook page as much as you can. That'll bring more members to more exposure to our community. So stay tuned for more exciting activities from the KACT 2022 committee. Enjoy the rest of the weekend. It's drizzling a little, but it's supposed to be better tomorrow. So go for a hike, go for a walk. Have a good night. Enjoy the night. Thank you all. Thanks for joining.
Thank you.
Thank you.